Do I have a rotator cuff tear?
Welcome back to this series on shoulder pain. Today we are covering rotator cuff tears and what this means for you. Drop a comment down below if you've been told you have a rotator cuff tear and your experience of it.
All right, let's just dive right in. Picture this. You've been dealing with some shoulder pain. You finally get an MRI, and the report comes back with some words that can sound, well, pretty scary. Rotator cuff tear. Now, hearing that your rotator cuff is torn can fill you with anxiety. It sounds serious, maybe even permanent. So, what does it actually mean for you and your recovery?
So here's how we're going to break this all down today. First, we'll tackle that scary-sounding diagnosis head-on. Then, we're going to uncover a really fascinating idea called the gray hair paradox. After that, we'll ask the big question. Is the tear even the cause of the pain? We'll explore why your personal story matters way more than any scan, and we'll finish up with a hopeful look at what actually works to get you feeling better.
Okay, so first things first. Let's talk about that initial shock, that moment you see the word tear on a medical report. Before we get into what helps, we have to understand what a tear on an MRI really signifies. And look, it's totally understandable. The word tear just sounds bad, right? It brings to mind images of something being ripped apart, permanently broken. It can make you feel fragile and maybe even make you think that a big intervention, like surgery, is the only way forward. But, and this is a big but, the reality is way more nuanced. And honestly, it's a lot more optimistic than you might think.
And that brings us to what I think is the most important part of this entire explainer, what I like to call the gray hair paradox. And trust me, this is where the whole story takes a really surprising turn.
So, what is this paradox? Well, in a nutshell, it's this. Research has found a massive disconnect between what an MRI scan shows and what a person actually feels. It turns out, the damage you see on an image often has very, very little to do with the pain someone is actually experiencing. Just take a look at this data. This is a total game changer. In studies of people with absolutely no shoulder pain, rotator cuff tears are surprisingly common. And they get way more common as we get older. In our 50s, about 15% of us have a tear without any symptoms at all. By our 80s, that number jumps to over 35%. It really suggests that for many of us, these tears are just a normal part of the aging process.
And this next chart really drives the point home. A large study looked at hundreds of people and found something incredible. Of all the full-thickness rotator cuff tears they found, nearly 2/3 were in people with zero pain. The tear was right there on the scan, but it just wasn't causing them any problems whatsoever.
This has led researchers to come up with a fantastic analogy. They call these age-related tears the gray hair of the shoulder. Think about it. Gray hair is a normal sign of aging, right? Not a sign of disease. Well, in the same way, many of these tears are simply age-related changes, not necessarily an injury that's causing your pain.
So if the tear isn't always the bad guy, then what is? This makes us question whether the tear we see on the scan is truly the cause of the pain. And the answer is that pain is so much more complex than just a picture. You see, that structural finding on a scan is just one piece of a very large puzzle. Your actual experience of pain is influenced by a huge range of factors: your biology, your psychological state like stress or anxiety, social factors, lifestyle habits like sleep and nutrition, and just your general health. Pain is a complex experience created by your brain based on all these inputs, and the signal from a tissue is only one of them. And here's the crucial point. Major research has confirmed this again and again. They've found that how much pain someone feels or how long they've had it doesn't really correlate with how big or severe their rotator cuff tear looks on an MRI. It's wild. Someone with a small tear can have a ton of pain, while someone with a large tear might have none at all.
So all of this builds to a new, much more empowering perspective. If the scan isn't the whole story, then what is? The answer is you. We need to shift the focus from the picture to the person. Your story and how you function in your daily life, that's what truly matters.
And this is exactly why a good clinician won't just treat your MRI report, they'll treat you. A thorough clinical assessment where they actually listen to you and carefully examine how your shoulder moves and functions tells the real story. It provides all the context that a black and white image simply can't.
So what does that look like? Well, it starts with your story, your history, your activities, and your goals. What do you want to get back to doing? Then it involves careful observation, looking for things like muscle loss. It includes objectively measuring your range of motion, and critically, testing your strength. These functional measures tell us far more about how you're going to do than the picture of the tear itself. This all leads to the final and most empowering part of our conversation. Let's talk about getting better, because there is an incredibly hopeful and effective path forward.
I want to start with just one number: 75%. According to major studies, that is the success rate for non-surgical care, like physical therapy and exercise, for people with these full-thickness rotator cuff tears. Think about that. 3 out of 4 people get better without ever needing surgery.
And hey, this isn't just some temporary fix. Long-term studies that follow these patients show that this success is incredibly durable. After achieving success at 3 months, it's maintained at 5 years, and even at over 10 years. Non-operative care works, and it lasts.
So let's summarize the key takeaways. First, focus on your function and your quality of life, not on chasing a perfect picture on an MRI. Second, exercise and physical therapy are the absolute cornerstone of effective treatment. Third, you often don't even need an image to start high-quality, effective care. And finally, remember that you can become completely pain-free and fully functional even if a follow-up scan shows the tear is still there.
Which leaves us with one final thought to consider. When it comes to your shoulder, what is the ultimate goal? Is it to have a perfect picture on a scan, or is it to live a full, active, and pain-free life? All the evidence suggests you can have the latter, regardless of the former.